I'm gonna show you a massive shortcut to improve your mobility, specifically within your shoulder and your shoulder joint, also more so in that rotator cuff area. Our connective tissue, also known as fascia, connects all systems, cells, and structures in the body together, but it also innervates the muscle cell and the fibers. So we need to actually think, how does our connective tissue move? Because it's not a linear structure like a muscle. A muscle has its job and it's gonna contract and expand. But our connective tissue, if it's holding everything in the body together, it's moving and adapting and adhering to how you position your body throughout the day. So if you're seated at a desk like this, collapsing these low ribs, rounded shoulders, your head is protruding forwards, and then you're here for 8 hours a day for months, if not years, then you decide to go to the gym and now you're working out like this because your fascia has started to build that memory and started to grip into this alignment. Now, when you go to the gym or do any activity, you're actually strengthening yourself further out of alignment. So what we need to do is understand, where is the fascia gripping onto? And that's typically the front and sides of the body, or it can actually be anywhere because we're all unique. So with this video, I'm gonna show you how to release your connective tissue to really expedite your range of motion within your shoulder. And all you need is a rolled up towel. Let's jump on in and I'll see you in the set. First off, let's grab a rolled up towel, roll it up nice and tight, because this is gonna be your fascia decompression tool. If you have a block with block therapy, of course, use that. That's a lot more dense. There's a lot more that you can do with it, and that will expedite results significantly, but this still does wonders. We're gonna be doing 3 positions. These are the 3 positions I personally think you're gonna get the most benefit from. Before we do that, let's test out where you're at. What's your range of motion in the shoulder joint? What kind of pain are you feeling? Where are your adhesions? First thing I want you to do, very classic, test out your range of motion. How is it feeling? Where are there limitations? Does it feel a little gluey, sticky? Can you even raise your shoulder this high? If you can't, that's okay. Another thing I want you to do is lay flat on your back, and we're just gonna do some internal external rotation. So if I do my external rotation, keep the shoulder joint on the floor, elbow on the floor, and I'll bring it into that external rotation. Do you feel any limitations when you do this? Is it in the shoulder? Is it in the elbow? Is it in the hand? Is it in the pec? It could be in all these different areas. And now let's test it, that internal rotation. Again, keep that shoulder joint pinned to the floor, and now come into that internal rotation. So that's my limitation. Again, I'm feeling this more in my forearm and my elbow, so that's an indicator that I should be focusing a little bit more here. So now let's start with the very first position. This is the upper side rib position, which is in alignment with the nipple or with the pec, and this is where that shoulder blade tracks. So if we're collapsing, gluing this area, that shoulder blade doesn't really want to move, and then that manipulates the rotator cuff and the shoulder joint. First thing we're gonna do is have the towel on its side just like this, and this is where the towel will be positioned. The whole key of what we're doing here is applying pressure. We're wanting to spend a minimum of 3 minutes here while connecting to the proper diaphragmatic breath, and that's gonna help calm the system down, allow the fascia to actually release so that it can start to migrate and go back to its proper alignment, start pumping that blood and oxygen flow to start healing this area. Bend that elbow, rest your head in your hand. Connect to that breath. As you inhale, expand your belly. As you exhale, make the belly nice and small. When you connect to that diaphragmatic breath, that calms the nervous system down. That allows you to pull in more oxygen, allows you to exhale more toxins and debris out of the system. Now, our adhesions can dive deep, and we need to be able to give it the time to sink, melt, and then actually effectively release. So now that you're settled in here, let's search towards the front a little bit. And then you can spend a minute here if you would like. You can spend more, less time. Once you spent a lot of time there, come back to neutral. Again, move slow. I'm expediting this, so this isn't a 20-minute video. And then let's roll and surge towards the back a little bit. And you might touch into that shoulder blade, that's all okay. You can bend your elbow, rest your head in your hand. If you find a screaming painful area, spend some time there. You can ease off, connect to that right intensity, and the whole idea is to feel that release. After the 3 minutes, you can spend longer here. Place your top hand in front of you, exhale up and off. All we're doing is bringing the towel a little bit higher, directly in the armpit, literally where the arm attaches to the rib cage. Now this is gonna be interesting, because if you can't bring your arm overhead because you might have frozen shoulder or major issues, Find that end range. That's super important. Find that end range, and now let's release all of these cobwebs in the way so that we can slowly increase our range of motion. Same rule of thumb, 3 minutes here. Search for that pain, search for the sensations. You're gonna know where you need to spend that time. And then you can search towards the back a little bit. You can use your opposite hand to support your head. This is getting directly into that like infraspinatus, more specifically those rotator cuff muscles. Spend time here, okay? Minimum 3 minutes. After 3 minutes is up, nice and slow, top hand in front of you, exhale, up and off. We're gonna be doing an outer forearm position. A lot of us are trapped like this. We do deadlifts, we do any really like bar movements, specifically in a prone position. Let's release the lateral portion, the outside portion of the forearm. Position the outside of your forearm on the towel, and now nice and slow, you're gonna bring either your lower rib cage or your belly directly over top to apply that pressure. Now we're sandwiching the forearm between the towel and your body weight. Now all we're gonna do is connect that breath as you inhale, expand the belly in towards the towel, and then exhale, make it nice and small. Now you can open and close your hand, because when you do this, you're gonna notice movement under the towel. So now once you spend that 3 minutes here, nice and slow, exhale, up and off. That's gonna make some crazy changes if you spend the minimum 3 minutes in each position. Test out the range of motion. After you've done this, of course, you're gonna have to pause this video and test it out, do the positions, and then feel it with that other side. If you wanna work the other side, mimic those 3 positions on the left side, move around, see how you feel. So if you want more corrective exercises for me to explain, I can make a separate video to this. Just let me know in the comments below. I'd be very excited to make that for you. In addition, please let me know in the comments if this has helped you out. That makes me obviously very excited. The whole point of this is to help you out with your body, your overall health in general. So if you like this video, give it a thumbs up, make sure you subscribe, leave any comments you want below, and I look forward to seeing you in the next video.